Welcome to the Carter Center's 24th Annual Rosalynn Carter Georgia Mental Health Forum. It's so great to see all of these great friends and colleagues in the mental health world here with us today. My name is Byrd, and I have the real honor of working with former First Lady Mrs. Rosalynn Carter and leading the mental health program here with a great staff. Our attendance today is over 192 people. We still have people coming in, which I think is really indicative of the growing momentum here in Georgia around behavioral health, and also what the Carter Center is seeing nationally and globally. Although our agenda does not cover all of the wonderful work that is taking place in Georgia right now, we will be focusing on particularly vulnerable populations, including the population targeted in the Georgia Settlement Agreement, Georgia's children, and the growing older adult population with serious mental illness. The agenda will also address the need to serve the greater Georgia population by investing in prevention and ensuring that individuals and families are able to access supports and services early, thus preventing disability and crises which are costly to individuals, their families, and the greater population. We have members of the Georgia Settlement Amici and our Department of Behavioral Health Commissioner here with us today to provide an update on the state of Georgia versus the U.S. Department of Justice settlement extension. We will hear about the great progress our state is making and the work that remains to be done. Hard work by many of you in this room resulted in significant budget appropriations for this coming year, a part of which will help Georgia continue its efforts to rebuild services for our children and youth here in Georgia. We are truly excited about the $8.5 million that Governor Kemp has provided to expand school-based behavioral health. Our first panel will discuss the great successes as well as the challenges that the state faces in building and sustaining school-based behavioral health services. Prevention and early intervention has always been a focus for Mrs. Carter. The Federal Family First Prevention Services Act aims to prevent children from entering foster care by allowing federal reimbursement for mental health services, substance use treatment, and in-home parenting skill training. All services well overdue. It also seeks to improve the well-being of children already in foster care by incentivizing states to reduce placement to children in congregate care. We look forward to hearing today the opportunities this federal legislation provides for Georgia and the U.S. Then we will hear about a population that unfortunately doesn't get enough attention, even though it's growing in numbers by day, especially here in Georgia, and that is the older adult population. We will hear how a coalition is working to build the state's capacity to meet the behavioral health needs of its older citizens. And finally today, the 2018 marked the 10th anniversary of the Mental Health Parity and Addiction Equity Act, legislation which Mrs. Carter was instrumental in getting passed 10 years ago. Full implementation of this act in Georgia is way overdue. We know that people with mental illnesses and addictive diseases continue to pay substantially more out of pocket for their behavioral health care than they are for their physical health or other illnesses. The Carter Center and other key stakeholders are banding together to address this ongoing discrimination against persons with behavioral health challenges. We are committed to making certain that Georgia and nationally we do not continue to fail in covering behavioral health care. I encourage you to read the full bios of our expert panel members. They're included in your packet. As you can see, we have a really packed day. And as far as housekeeping, I encourage you not to miss anything. Bring your food and drink back into the chapel after your breaks. And you can find restrooms one floor up and one floor down from this level. Now at this point, I'm honored to introduce Jason Carter, grandson of President and Mrs. Carter. Chair of the Carter Center Board of Trustees. Jason, I want to thank you for being here today and the time you've taken this year in advancing mental health locally and globally. I have thoroughly enjoyed working with you this year and learning more about your many years of work with the Carter Center and your grandparents to advance peace and health for some of the globe's most poor and disenfranchised populations. It was a true highlight for me and the mental health program to have Jason join us at the first, in London, for the first ministerial conference on global behavioral health, and for you to have the opportunity to experience firsthand the global momentum which your grandmother has helped to build, as well as the successes of the Carter Center Mental Health Program domestically and internationally, and on our ongoing commitment to improving the lives of persons who face mental health challenges. Jason, thanks for all you do, and if you could stand and at the...
Thank you very much. Welcome to all of you. Many of you I know and I'm familiar with from my time in the State Senate, and it was always wonderful when I started talking about mental health issues at the Georgia Capitol, because I immediately transformed from one person's grandson into another person's grandson. It's amazing how little anybody thinks or talks about Jimmy Carter in the mental health space, because it is so dominated by my grandmother, Rosalynn. I normally introduce my grandparents with a series of stories about how they're just regular people. You know, they're just like y'all's grandparents, assuming that y'all's grandparents are sort of, you know, rednecks from small town Georgia, whatever. Talk about how their fridge is full of deer meat and things like that. But lately, I've realized that that's just not true. My grandmother's not a regular person. She is a totally exceptional one. And I just want to say two things in introducing her. The first is, don't underestimate the power of a single conversation about mental health. I know that there's 192 people that are going to be in here. I know that all of you represent bigger organizations and other people who participate, and this is really just sort of the tip of the iceberg of all of the work that gets done on mental health, and that many of you are having conversations every day. I was just discussing Northwest Georgia, where I'm from originally, and the way in which we can sort of bring the mental health into not only schools, but into each family in the state. And there was a conversation when my grandfather was running for governor in 1966, that my grandmother had. And it was with a woman who was providing care to a child with mental illness. And that single conversation, now 53 years ago, spawned a lifetime of effort and unrelenting focus on mental health. As a result of that, truly, when we were at the Ministerial Conference on Global Mental Health, there is a huge amount of global momentum. And again, I get introduced as a relative all the time. But to walk around that group and to have people from Nigeria, to have people from the UK, to have people from all over the world, Hong Kong, come to me and say, I have so much respect for what Rosalynn Carter has done. Thank you so much. It was a truly humbling experience. That's one thing in the Georgia Capitol. It's another thing when you're talking about people from across the country. But I'll conclude with this. I always say this is the last thing I'm going to say, and I always have two things left. And I apologize. That's such a politician thing. It's terrible. Second to last thing I'll say is, don't underestimate the power of a conversation about mental health. And don't underestimate the power of a single human being to make an enormous amount of change. Because remember, when my grandmother had that conversation, she wasn't the former First Lady. She wasn't the former First Lady of Georgia. She was just out shaking hands, campaigning for a state senator. And that kind of power that resides in a single human life is really real. And today we sit here with 192 people with a giant number of super incredible successes over the course of time, a true lifetime, many lifetimes of transformation in the mental health space. And so much of that came from the spark that's here. So the concluding comment I'll make is this. I am about to introduce to you, this is the 2019 Georgia Mental Health Forum, but I'm going to introduce to you the entirety, 100% of the 1970 Georgia Mental Health Forum, who is sitting right now. She's going to speak from her chair down there, but I will say that she told my kids at dinner last night that she said, I've got this walker, but I'm not going to have it for long because I've been working out. So.
Wait just a minute.
You want to stand or sit?
Can you take that out? I think I'm going to stand up. Jason? Yeah. Love it. Grandchildren, wonderful. I am so happy to be here this morning and to see all of you. You know, I'm okay. I'm almost okay. And I didn't walk up on the stage this time, but next time you come to a meeting, I'm going to be walking up because I'm almost there now, and it won't take me long to go get the whole way with being able to do what I want to do when I want to do it. Jason makes me think about how difficult it was in the beginning, because nobody wanted to be associated with mental health. Nobody wanted to come to me. I couldn't even get staff from governor's office to come to my meetings. I would have 2 or 3 that came every time, and that was it. But we separated the mental health out of physical health because, as it was, mental health got nothing. And so that's the way we started. And the only thing I could do was try to make the issue and try to make it an acceptable issue. And talk about it a lot. And that's about all I could do in Georgia in the beginning. But it was that way all over the country. And it was hard, but it was rewarding after a while, because when people, it took a long time to be rewarded. but you had to just get it to be an issue, which is what I did and what I worked on for so long. Well, I want to welcome you to this, you said 29th?
2019.
Oh, okay.
Sorry, 24.
Yeah, because I had 24th in mind. The 24th Annual Georgia Mental Health Forum. And we're going to talk about, as he said, the work we've already done, but we're going to have some other issues to talk about that I'm really interested in hearing about. New federal legislation, like the Families First Act. I'm not familiar with that. I'm looking forward to hearing about it. And also strengthening existing federal legislation like the Parity Act. The Parity Act was passed in 1908. In 2008, that's right. And it was not implemented. So for so long that the insurance companies just started making up their rules for it. And they were making up rules for it in different kinds of rules in different places. And so it's so messed up now that there's not, maybe 3 or 4, maybe a few more states that have implemented it as it was passed to act. And so I decided about 3 or 4 months ago that we were going to get it passed in Georgia. If we can get it implemented correctly in Georgia, it'll be a model for the whole country because there are so very few. It's not going to be easy, and I'm looking forward to talking to the panel today because I haven't been brought up to date on what's happening, but they've been having meetings here, and they've been meeting with people in the Capitol that are interested in the issue. So I'm really, really excited about that. Well, here at the Carter Center, I think you all know that our programs are run by fundings from donors. Donors are essential to our program. We wouldn't have programs, our programs, if it were not for people who were dedicated and work on the issues, help us with the issues we're interested in. And mental health, of course, is one of the Carter Center's issues that is supported by donors, just like all of the others. And it took a long time to get funding when we started the program and I don't think we got any funding from donors back then. We set up, as I said, a separate department for mental health with maybe just 2 or 3 donors. But anyway, now we have wonderful donors who support our program, and I just want to thank every single one of you. Some of you are here because I've seen some of you, but I have a list of people who are supporting this program, and I know that some of them are not here, but I want to call out the names, and also the list is in your program, and you can see who is helping us, but I need to, I'm going to call them out anyway. Betty and Davis Fitzgerald Foundation, Casey Family Programs, Georgia Department of Behavioral Health and Developmental Disabilities, Georgia Department of Human Services. This is really wonderful having the state so involved. Healthcare Georgia Foundation, John and Polly Sparks Foundation, Magellan Cares Foundation, Schwabel Family Foundation, Toll Charitable Foundation, UCB Inc. Is UCB Inc. here? I'm going to have to find out who they are. I know the rest of them. Waterfall Foundation, and many individual donors. I'm deeply, deeply grateful to all of them. If any of you are here, I would like at some point today to see you and thank you in person. And that is the end of my remarks, and now Eve is going to direct us through the beginning portion of our day. Thank you again for being here.